One of the biggest frustrations I hear from cosmetic dentists sounds something like this. They say we're getting consultations booked, but a lot of them just don't move forward with the treatment. And when we look at the numbers, the close rate is usually sitting around 20 to 30%. Now, if you're running a cosmetic dental practice, that number should make you very uncomfortable. Because with the right consultation structure in place, it's completely normal to see 60, 70, or even 80% case acceptance. And the interesting part is, the higher close rates don't usually come from being more persuasive, more aggressive, or more salesy. They come from having a better structure for the conversation. Because cosmetic consultations are very different from normal dental appointments. And if you treat them the same way, you'll lose a lot of cases that should have been an easy yes. So in this video, I'm going to walk you through a 5-phase consultation framework that allows you to close more high-ticket cases while still making the patient feel comfortable. Before we get into the framework, we need to understand something very fundamental. Most general dentistry is problem-based. A patient comes in with pain, they have a cavity, a cracked tooth, or something that needs fixing. In those situations, the patient already believes they need your treatment. Your job is simply to explain the solution. But cosmetic dentistry works very differently. Because cosmetic treatments are desire-driven. The patient isn't in pain, they're coming in because they want to change something about their appearance, their confidence, or the way they feel when they smile. And that means the consultation is not just clinical, it's emotional. The patient is asking themselves questions like, will this actually be good for me? Is it really worth the money? Can I trust this dentist? And if the consultation doesn't answer those questions properly, the most common response you'll hear is, I just need to think about it. Which in most cases really means, I'm not yet fully convinced. The biggest mistake I see dentists make in consultations is jumping into treatment way too quickly. The patient sits down, and within a few minutes the conversation moves straight into scans, procedures, and pricing. But if trust hasn't been established yet, the patient's brain is still in evaluation mode. They're trying to figure out, is this someone I can trust to change my smile? So the first phase of the consultation should be focused entirely on connection and understanding. That means asking questions like, what made you start thinking about improving your smile? What bothers you the most right now about your smile? If we could design your ideal smile, what would that look like? These questions do two very important things. First, they allow the patient to feel heard, which immediately builds rapport. And second, they reveal the real emotional drivers behind why the patient is sitting there with you now. Because people rarely spend $10,000 or $20,000 on teeth purely for functional reasons. They do it because they want to feel more confident in their life. Now, once you understand the patient's motivations, the next step is something many practitioners skip entirely, and that is expanding the problem. This doesn't mean making the patient feel bad about their smile. It means helping them clearly see the gap between where they are now and where they want to be. For example, if the patient says they feel self-conscious in photos, you might ask something like, how often do you find yourself hiding your smile in pictures? Or, has that ever affected your confidence in social situations or work? What this does is bring emotional impact to the surface. And when patients start articulating those frustrations themselves, the desire for change becomes much stronger. Because now the treatment isn't just about their teeth, it's about confidence, self-image, and quality of life. Only after the patient fully understands the problem should you move into the solution. This is where you present the future vision. Instead of immediately talking about veneers or aligners, you want to paint a picture of the outcome. You might say something like, based on what you've told me, the goal would be to create a smile that feels natural and something you feel confident showing in photos. Then you introduce the treatment plan as the pathway to that result. The shift is powerful because the patient is no longer buying the procedure, they're buying the result they want in their life. And when the outcome feels exciting and clear, the treatment becomes much easier to accept. Now we arrive at the part of the consultation that many dentists feel uncomfortable with, discussing the price. But most pricing objections don't happen because the treatment is expensive. They happen because the patient doesn't yet fully see the value. If you simply say the treatment will be $18,000, that number floats in isolation. But if the patient has already visualized the transformation, the investment becomes much easier to process. This is where context matters. You might explain the materials used, the customization involved, the longevity of the results, and the level of care that goes into the process. The goal is not to justify the price. The goal is to show the patient why the result is valuable. Because when the perceived value exceeds the price, hesitation disappears. Even with a great consultation, some patients still have objections. Usually they fall into these three categories: price, timing, or the classic, I need to think about it. The key here is not to push harder, it's to understand what the real hesitation is. For example, if someone says they need to think about it, a helpful response might be, of course, just so I can help you better, is there anything specific you're unsure about? The question often reveals the real concern. Sometimes it's financial, sometimes they want reassurance about the results, and sometimes they simply need a little more clarity. Once you understand the objection, you can address it calmly and professionally without turning the consultation into a sales battle. When cosmetic consultations are structured properly, something interesting happens. They stop feeling like sales conversations. Instead, they feel like guided decision-making processes. The patient feels understood, they clearly see the benefits, and the treatment naturally becomes a logical next step. That's why practices using this framework often see case acceptance rates well above 60%. Not because they're pushing harder, but because they're guiding the patient through the decision with clarity and confidence. If you're generating consultations but your case acceptance feels lower than it should be, the problem is rarely the patient. It's almost always the structure of the consultation itself. And once that structure is refined, the exact same leads can produce dramatically different revenue outcomes. Because in cosmetic dentistry, the consultation isn't just a conversation, it's the moment where trust is built, vision is created, and the decisions are made. If you need help improving your sales consultations, book a free call with us. We'll help you analyze your current methods and help you build a better version of that so that you can build more revenue, more patients, and improve your practice.